Hello, welcome to this video where we are talking about preeclampsia and eclampsia. Simply put, zoomed out, what this is a systemic disease of abnormal blood vessels that impacts organs. I used to think that it was a hypertensive obstetric emergency, which is part of it, yeah, but there's quite a bit more going on. And the aim of this video is to try to unify what may seem to be kind of random or chaotic symptoms under the lens of this systemic disease of abnormal blood vessels that impacts organs. There's a commonality there. And if you understand that commonality, these side effects may seem less random, and that can help treat people. So let's talk about how this is happening. This starts at the spiral arteries. And spiral arteries, what they do is they lie inside the uterus. And what they do is when a placenta is embedded inside the uterus, they supply that placenta with mom's blood. And when that placenta does come, the uterus has a roommate, they need to make some accommodations. They're not necessarily used to having that roommate. And so they need to, do some renovations to prepare and to meet the needs, literally and figuratively, of that placenta. And so they do that by, I don't want you to get too hung up on this part, but what they do is they have these things called trophoblasts, which line the endothelium of these spiral arteries. And what those trophoblasts do is they make those renovations. And those renovations aim to meet the vast and intense needs of that growing placenta so that placenta can do its job adequately. But in the preeclamptic and eclamptic patient, that does not get done, all right? And so these spiral arteries remain the way that they have been, and the needs of the placenta are not met, and that placenta becomes sad and ischemic. And sad and ischemic organs, they release chemical distress signals. And what those chemical distress signals do, well, first of all, they're released into mom's bloodstream, so their impacts are going to be systemic for mother. And those systemic effects are going to be vasoconstriction, platelet aggregation, and microclots, which are not good, and vascular permeability. And by vascular permeability, what I mean is essentially fluid can leak out of these vessels, or what could cause what's called leakiness. And so we might be seeing edema, which, pregnant women experience on their own outside of preeclampsia and eclampsia. But this edema can be quite a bit more involved and targeted to vital areas. And we'll talk about what those ramifications might be. Some of the hallmarks of these patients are going to be increased blood pressure. I want you to keep an open mind about numbers, because every time we put corners and edges on things, you see a patient who falls between them. But clinically, a lot of times this is going to be systolic greater to or equal than 160, and a diastolic greater to or equal to 110. Protein in the urine, which in EMS, we don't necessarily have those diagnostics, but it might be good to ask your patient, hey, have you had a hard time urinating lately? There's usually a reduction in urine output that goes along with this. And edema. And again, we talked about that. How are these organs impacted? Well, let's start with the brain, and we'll kind of go down the line, and we're going to hit the hits. All organs are going to be impacted to some degree, but let's talk about the things that are very pertinent to EMS. That's going to make our patient more critical and how they might present. Due to what we just discussed, the brain, your patient might experience headaches, vision changes, seizures. If your patient is exhibiting seizures, they then move from preeclamptic to eclamptic. All right, that's the only difference there. And if your patient is preeclamptic and then they start seizing, they are now eclamptic. This is going to reduce cerebral perfusion due to something called spasming. These vessels, due to these chemical signals that are being circulated systemically, they lose their ability to kind of regulate themselves. And there's going to be portions of the brain that are hypoperfused. On top of that, you have edema, like we talked about, that leakiness, that vascular leakiness. And so I have fluid leaking outside of the vasculature, and those things can cause those headaches, vision changes, and potentially seizures. Kidneys, this is going to decrease their ability to filtrate due to a reduction in blood flow. So they're ischemic, and any organ that is ischemic is going to not be as able to perform its job. And the kidney's job is to filter things. And so you could see protein in the urine as well as increased creatinine, which, in EMS, again, we're not going to have access to those lab values and things like that, but it's just something to keep in mind. Particularly, though, I want you to ask your patients that you suspect might be experiencing this, or maybe you're trying to rule out a differential. How's it been using the restroom? Have you been able to urinate? You feel like you're holding on to a lot? Just have a discussion with them about that. The lungs, this is going to, again, we talked about leakiness, and so what is particularly dangerous with the lungs is, alveolar fluid in the alveolar space, so pulmonary edema, and this is going to display itself as crackles, and you should be listening to lung sounds on every patient, particular your obstetric patients. Liver, I included this one because one of the key symptoms that these patients might be experiencing as well is right upper quadrant pain, and if an ischemic liver is going to sometimes present with that. So what are we going to do for these patients? Definitively, the placenta needs to be delivered. You think that it is the thing that is continually sending out those chemical signals that are in turn injuring this patient. And so delivering that placenta is the most definitive way to stop that from happening. Now, say you are trying to do that, or it's taking some time, or you're not able to. We have to treat the symptoms. And so we're going to start with seizure-like activity. You're going to treat that acutely and sustainably. Acutely is going to be with some benzodiazepines, most likely. Locally, 5 milligrams of Versed IV, IO, or IM. And then sustainably with some magnesium. Magnesium is going to do a few different things. It's going to essentially dull or inhibit the neurons' abilities to chatter with each other. And so during seizure-like activity, they are chattering very, very quickly, very, very excitedly, and this is going to dull that. In addition to that, they're going to relax the smooth muscles, particularly in the cerebral vasculature. So they're going to help them stop spasming, which can can improve blood flow to areas of the brain and kind of unify that perfusion so that the brain overall has a much healthier perfusion status. Additionally, addressing hypertension. Locally, that's going to be labetalol, 10 milligrams IV push. Now, these are sick patients, everybody, and I think that we needed another look at just understanding what's going on with these preeclamptic and eclamptic patients. And I think the more we understand about how this is happening to them, I think we'll be better at identifying it and in turn treating it. If you guys have any questions, reach out. Thank you.